Hello, I'm Heidi Bougher, a transplant nurse coordinator. I'm going to walk you through the pre-lung transplant evaluation process. To start, although it's performed on an outpatient basis, our pre-transplant evaluation process is fairly rigorous. Each day of evaluation can be 6 to 8 hours long over 4 to 5 days. That means if you live more than 2 hours away, you should plan on staying locally in order to be on time for the early morning start. We can provide a list of local lodging options for you to set up your stay for the week. You're required to provide 2 things to help everything go smoothly. 1, bring a support person to assist you throughout the process. And 2, make sure you bring enough supplemental oxygen to get through your days and nights. You can work with your local supplier to ensure you have enough oxygen supply. The next step is to receive authorization from your insurance company, which can take from 24 hours to a couple of weeks. Once we receive authorization, we will schedule your lung transplant evaluation. Your detailed schedule is then created and mailed to you so you know in advance what to expect every day you're here. On your last day of evaluation, you will receive conscious sedation for your cardiac catheterization, so you will not be able to drive for 24 hours. After testing is complete, your case will be presented at committee and a transplant coordinator will call you with the outcome. Possible outcomes include approved to list, more testing or follow-up needed, or not a candidate for lung transplant listing. If you're approved, financial authorization is required, which can take 2 to 4 weeks to obtain. Upon authorization, the lung transplant coordinator will notify you and then list you in UNOS. Once listed in UNOS, we will receive your lung allocation score, or LAS, that will identify where you're placed on the wait list. Once you're on the wait list, you will have follow-up appointments in our clinic every 2 to 3 months until you receive your transplant. You will then transition to post-transplant care. As always, we're here to answer any questions you might have. To learn more, visit uchealth.org/transplant.